Nurses across Canada have been sounding the alarm over staffing shortages for years, but there is a new sense of urgency in Ontario. According to new data, Ontario has the fewest number of registered nurses in the country. Listen to this. There are just 651 nurses for every 100,000 people. Just 651. Experts blame poor working conditions, burnout, low wages for the growing shortage, and they say the crisis will only get worse if government action and support is not provided. Joining us this morning from Kitchener is the Provincial President of the Ontario Nurses Association, Erin Ariss. Good morning.
Good morning, Lindsay.
This is, what, the 9th year in a row that Ontario has had the worst nurse-to-population ratio in this country. What's the main driver behind this?
Really, we've seen this happening, an erosion of our work, the worst working conditions, quite frankly, probably in the country. So what's led up to this is, a culmination of shortfalls by the government, to be perfectly honest with you. We saw the introduction of Bill 124. We've seen better pay and flexibility in other provinces in the United States. We see other jurisdictions, provinces offering, nurse-to-patient ratios to offer safe staffing. We see low staff satisfaction, burnout, and certainly an increase of workplace violence in all sectors of healthcare. It's just unsustainable at this point, but completely avoidable.
And why is this continuing like this?
Well, really, it's a lack of priorities or a lack of budgeting for priorities. Ontarians deserve the best healthcare, and that can be done through budgeting for healthcare, publicly funded healthcare, and it just hasn't been done by this government.
How is patient care being impacted by these shortages?
Well, we've seen over 200 emergency department closures between July of 2022 and June of 2023. So folks are not receiving the health care they deserve, that they pay for with their tax money. What we see is long waits in emergency departments. We see seniors in their homes in crisis waiting for nurses to come, yet there aren't enough nurses to provide that care. And we see nurses, first and foremost, that are being destroyed by the work environment that they're working in. And again, completely unavoidable, and there needs to be a change.
When you say destroyed, what do you mean? I mean, what's life like for nurses right now?
Nurses are burnt out. They're caring for more patients than they've ever cared for before. We're hearing of nurses, they're looking after 30 to 50 patients at a time in emergency departments. In ICU, we see nurses where they would normally look after one of the sickest patients you can imagine, 1-to-1 nurse-to-patient ratio. They're working and looking after 2 to 3 when they should be looking after 1. You can imagine how this affects their home life when they go home. And they're not getting vacations. They're being scheduled 16-hour days. So things are pretty bad right now, Lindsay.
So what needs to be done? What's at the top of the priority list?
Investment in our public system. There was an opportunity for the Ford government certainly to implement a piece of legislation that would offer safe patient-to-nurse ratios, and instead they defeated that in the legislature. And certainly compensation. Nurses need to be compensated just like anyone else. We have the same mortgage payments, the same car loans as everybody else, but we're hearing of nurses in the north that are relying on food banks, and that is completely unacceptable. It's unacceptable for anyone in Ontario, and certainly for nurses.
Erin Ariss, Provincial President of the Ontario Nurses Association. Thanks for joining us.
You're welcome.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.